Hi, I'm Terry Goldstein, the publisher of Hudson Valley Parent Magazine. We've been around for 27 years and we're a resource for parents. What better resource could we be than finding out what's going on with COVID and especially the new vaccine that's just been introduced for our young children? So we've invited two renowned doctors who are from Cornerstone Family Healthcare and find out what their perspective is on how we should be handling the COVID vaccine. I'd like to welcome Dr. Silber, who is the Chief Medical Officer and pediatrician, and I'd like to welcome Dr. Pointer, who's also Chief of Pediatrics. So thank you for sharing this afternoon. We really appreciate you giving of your time. Any introductory remarks, Dr. Silber, that you'd like to make about the new COVID for young children?
Yeah, hi. Thank you for joining us here as well today. This is definitely well worth the time because a lot of people are talking about this, and we're spending a lot of time talking about this here. The COVID vaccine has been, it's been around now for almost a year, but it just it just got approved down to the 5 to 12-year-old age group. So we have a lot of experience for 12 and up. When I talk to parents, and I have kids of my own, and I have an 11-and-a-half-year-old that just got vaccinated last week. And in general, when I talk to people about the COVID vaccine for children, I think about different reasons why we want them to get vaccinated. So there's obviously the clinical part, the safety part. So a lot of people feel like COVID does not affect children at all. But we found, especially in the age of Delta, we're seeing a lot more hospitalization and illnesses in that 5 to 10, 11-year-old age group. So statistically, we have about 8,300 COVID hospitalizations in that age group. And when we think about who those people are, it's not just people with chronic or underlying conditions, but 1/3 of those kids have no underlying conditions. They're otherwise healthy children. And then out of that group that gets hospitalized, 1/3 of them end up in the ICU. There's also this multi-inflammatory disease in children, the post-COVID syndrome, where you get effects in the heart. And we've had about 5,000 cases in children in that from COVID. And that could be a lot more serious than hospitalized. So those are, when we think about some of the diseases that we use vaccines to prevent, this is a significant. We don't like to see one child with a bad adverse outcome. And then there are other reasons. There's the long COVID. There are kids that, about 10% of the kids will have symptoms that last 4 or 5 weeks, after they have COVID. So athletes that can't participate anymore, fatigue, headaches, things that affect school. So those are all some really good, solid clinical reasons I think that we need to think about getting the vaccine. But one of the more reasons, some of the other outcomes or things we've seen go on with COVID is missed school, loss of educational advantages, loss of education gaps, mental health problems, loss of caregivers. These are other really secondary outcomes that we've seen with COVID that we want to prevent. And I also talk to people about who else are you protecting? There is secondary transmission. So is there grandma at home? We're seeing, we saw a dip in COVID cases, but now we're seeing it kind of stabilize. And I talk to people like, we're going to start getting together with Thanksgiving, and we're going to possibly see an uptick again. And who you're visiting and who you want to keep safe, and the grandparents and the other people that may not be protected. For me, that's personally a really good reason. I have a relative, an in-law that for medical reasons couldn't get vaccinated, and I don't want to bring my child around them. So those are real good personal reasons, and we've heard it time and time again. For society to get back on track, we want to defeat COVID. We want to get rid of it, and the fastest way is to decrease the amount of circulating virus in the community out there. So the more virus, the more transmission, the more chance it has to mutate. So really, vaccination is our best way out of it. So
thank you very much. Wait, I'd like to hold just 1 second. Can I turn to Dr. Pointer and ask, when parents ask you, how do I know if it's safe for my child? What do you answer them? And you're a pediatrician, you see kids all the time.
Yeah, that's really the most important question, right? Is about the safety of the vaccine. Obviously, the reason that we're doing this, the reason that we offer the vaccine is that we want to keep kids safe. So I would say, yes, the vaccine is definitely safe for kids in this age group, 5 to 11. Just to give you some background, as most people know, the initial trial enrolled about 4,600 kids in this age group. Of those, 3,000 had the vaccine. This trial was reviewed extensively by the FDA and CDC prior to their approval of the vaccine. And what it showed is, of those 3,000 kids who received the vaccine, they were all well protected against COVID, and there were no serious vaccine side effects or serious vaccine related health problems in that group of kids. Those kids were followed for over 2 months. And the reason that time was chosen is because in vaccine history, the chances of adverse events or bad events happening outside of that 2-month range is extremely unlikely.
Interesting.
But, the monitoring of vaccine safety doesn't stop there. So since the vaccine rollout, over 1 million kids have been vaccinated just in the past week, and those kids continue to be monitored. This is the most extensive safety monitoring really in vaccine history, because in addition to our usual monitoring tools, we have an additional one called vSafe, which parents can get on their own phones or devices, that continues to monitor these now millions of children who are receiving the vaccine. As a pediatrician, I think my families know this too. I would never recommend something to my patients unless I thought it was safe. And to give you an idea of how safe I think it is, I had my own 2 young kids, 7 and 9-year-old, vaccinated this past weekend.
So let me ask you, Dr. Pointer, what's the difference between the vaccine that I got, or maybe you both got, versus what we're giving our kids? And how does it differ from the teens versus this new shot that has been approved for the younger children?
Yeah, great question. So the vaccine is very similar. It's really the dosage that's different. So the vaccine that the 5 to 11-year-olds are getting is 1/3 the dose of the adult vaccine, but the duration is similar. So they receive a vaccine at their initial vaccine visit, and then they receive the second dose 3 weeks later.
Okay, that sounds great. I'd like to switch to Dr. Silber. Dr. Silber, you mentioned, I'm not going to say it right,
Myocarditis.
heart inflammation. Tell me what that is.
So myocarditis is inflammation of the heart. You could get that post from a virus itself. So there's a viral myocarditis. There is something called vaccine myocarditis, which tends to be much more mild. And they did see an incidence of about 1 in 100,000 cases in the 12 to 29-year-old age group of myocarditis. And that was one of the adverse outcomes they picked up. So it was relatively mild, 77% recovered completely. There were no deaths from that. And so that is the one side effect that they're really looking at closely. So it's inflammation of the heart gets larger, sometimes they're admitted, and most of the time they resolve on their own. But we have to remember that myocarditis is something that we do see in that age group in general, more than the regular population. And one of the things that causes myocarditis is COVID itself. So the incidence of getting a myocarditis or this heart condition from the infection of COVID is 16 times higher than getting it from the actual vaccine. So that's kind of where I looked at that, I said, the way COVID is going, the way it's circulating, you have a very good chance of getting either COVID or the COVID vaccine in the next 6 months. So the much safer choice is to get the well-studied vaccine, which has a much lower rate of myocarditis, but that inflammation we did see in about 1 out of 100,000 people as a side effect of the vaccine.
Should I be concerned for my children as to which vaccine I get for them, considering you had Johnson & Johnson, which was single shot and done, and then the 2 other vaccines? relative to this heart inflammation? Are there any studies on that? What's going on?
So, well, one, I mean, Alicia could point in too. So as far as Pfizer right now is the only vaccine that's approved for less than 18 years old. So right now for the children, we're looking at just Pfizer.
Okay. Thank you. There is, if my, Dr. Pointer, if my child has had COVID, maybe our whole family has had COVID, should they be vaccinated as well? The other thing I see is the periods of time as to after 2 months be vaccinated, after, the numbers keep changing. What do you know about that?
Yeah, so you're right. That has changed over time. The recommendations can be hard to keep up with. So right now, if you have had COVID, the recommendation is yes, you should still get the vaccine. Having COVID does give you some immune protection against the virus, but it doesn't give you as strong of an immune protection as having the vaccine itself. As far as timing after COVID, as long as children or parents are out of that period of quarantine and isolation, and as long as they're recovered from the illness, then they're cleared to get the vaccine. So there's no longer that waiting period in between having the disease and getting the vaccine, but it is still highly recommended if you've already had the virus to give you that extra protection before your immunity wears off.
Do you know what was interesting? I did see that if you actually had antibody or you had COVID before and you got the vaccine, the side effects were actually less in that group of kids that already had that had been exposed to COVID before. Where intuitively you might think, I've had the vaccine, I already had the disease, I had the vaccine, I'm going to have more of an immune response. But actually, those kids had such a little bit less side effects. And speaking of side effects, they're really pretty much very low. They're very similar to what we saw in the older population: soreness, achiness, and more so with the second shot than the first, but no severe outcomes.
Okay, so this is off the wall, I think. I had measles, mumps, chickenpox. I mean, the whole gamut. I'm much older than you guys. It was never requested afterwards that I get vaccinated. And yet Dr. Pointer, or one of you, said that the fact is that after you get COVID, you should be vaccinated anyway. Does that apply to other vaccines as well?
I mean, you could start with some, but every virus is different, and some viruses will give you lifelong immunity, and it's how it responds to your immune system. Some viruses need boosters, a lot, and some vaccines need boosters. So
influenza is a great example of that. You can have the flu and still get the flu again a couple of years later. That immunity can wear off over time.
Or even there's been an uptick lately in something called pertussis, which is whooping cough, right? So we were always giving that, as a baby, and a booster at 5. And when they saw that resurgence during teenage years, they added on a booster at the 11-year-old visit that we do now. So it's depending on the virus and the vaccine, immunity wanes. But measles is one of those that will give lifelong immunity, and which is why we really were able to eliminate it.
So what we see is, and what it seems the advice to parents is to talk to your pediatrician about what's the current status of everything in terms of healthy children, not only just COVID, because you are the ones who maintain and review what's going on in research right now. Am I right?
That's always going to be our advice, is talk to your pediatrician. Certainly. I mean, that's our job, is to keep up with what's going on, what new information is coming out. And I think, it's hard enough to be a parent. Obviously, we love when parents do some of their own research too, but with COVID, it can seem like things are changing all the time. So we're always happy to talk to families who have questions or concerns. And I'm sure if they're not our patients, their own pediatrician would be happy to do the same thing.
I mean, it's scary out there, all the information. It's really hard for people to weed through what's reliable and what's not reliable and what they heard. And we understand the one thing that all the parents have in common when they come in is they want to do what's best for their child, and it gets a little overwhelming to really make sense of what's out there.
Absolutely, even for me. There is a question about fertility, both in terms of women who are pregnant and getting COVID or getting the vaccine, as well as doing it for their kids. What can their kids expect in terms of being able to bear children later in life? How do we know that, and what should we be telling them?
So there's no evidence that the COVID vaccine affects fertility. And the truth is the vaccine just doesn't interact with the reproductive system in a way that could make that happen. This has been studied recently, and people who get the COVID vaccine are just as likely to become pregnant and have healthy pregnancies as those who don't get the vaccine. The American College of Obstetricians and Gynecology, they strongly recommend the vaccine to all people, including those who are hoping to become pregnant. I will say we've heard, some reports of women who say that their menstrual cycle has changed after receiving the COVID vaccine. They also report changes in menstrual cycle after having COVID itself. And lots of things can affect a period, everything from illness to stress to even changes in sleep and diet and exercise. But these are all temporary. And as I mentioned, no evidence that the COVID vaccine affects long-term fertility at all.
One question I'm going to stay with you, Dr. Pointer, is when parents ask, how do I prepare my child for getting a vaccine or a vaccination, when they get nervous and they get upset, any words to the wise?
I'm really glad you asked that, because I actually got some expert advice before I showed up. I talked to my 7-year-old last night who is terrified of getting the vaccine. And I said, if I talk to families who have kids who are scared of getting the vaccine, I said, what advice do you have for them? And he said, snuggles, headphones, and rewards. And I think those are all really good ideas. So certainly distraction is very important, whether it's, listening to their favorite song, as my son did, or playing a game on the phone or watching a video on the phone. Having something to look forward to afterwards can help make it a little bit less stressful, and can also give a positive association so that the next time they have to get the vaccine in 3 weeks, it's not as hard for them. As far as prepping ahead of time, I'll say, every kid is different. So there are some kids who, the more you talk about it, the more they think about it, they kind of get more and more worked up. Those kids, sometimes it's best to just kind of let them know on the way to the doctor's appointment, if then, and then try to get it done as quickly as possible. Some kids, like mine, really like to be prepared and feel like they have some control over the situation. So in those cases, it can be helpful to go through what they can expect. The nurse is going to come in, you're going to see the vaccine as she gets it ready. She's going to clean your arm with the alcohol, do the shot, you're going to get the Band-Aid at the end. For some kids, talking about those things and even maybe role playing them at home does give them a little bit of extra control and makes them feel more like they know what to expect when it's going to happen. I know I've talked to a lot of kids who are a little bit older who have their own really strong reasons for getting the vaccine, and talking to kids about that can be helpful too. So, I'm getting the vaccine so that I can, go watch a movie in a movie theater again, or I'm getting the vaccine for my cousin who had cancer, whatever it is. Like I said, especially those older kids can really feel passionate about that, and that can also help them overcome some of that fear.
Terrific. I want to ask last question, Dr. Silber, where can my children get their vaccination for COVID, and how does this work?
So there is a little bit more of a push to have this available in pediatric offices. So, we are making it available at our visits, but all the all the other regular places as well, I know are doing it. You know, through some of the pharmacies, you can sign up online and get it there as well. But I would say more so than than the adults. So there is more of a push to give it in places where kids feel safe and parents feel safe and trusted. So I know you can call Cornerstone and arrange to have it here with us. But for even the older kids as well, if you feel comfortable going to the pharmacies, that's sometimes works a little bit better with the schedule as well.
Okay, so I want to thank both Dr. Silber and Dr. Pointer for some great advice, and I hope that parents take heed and get vaccinated.
I can hear Dr. Pointer's next patient's getting ready in the next.
I know. There's a lot going on here, but I think the most important thing that we talked about today is, like you said, talk to your pediatrician, whether it's about the COVID vaccine or whatever other concerns parents have. I know a lot of kids haven't been seen by their pediatrician as much over the past couple years, and, we miss them. That's what we're here for. A lot of kids have had a lot of stress at school, at home. We're seeing a lot more emotional issues with kids. So yeah, reach out to us, come talk to us. If you haven't seen us in a little while, make an appointment to come in and see us.
Okay, thank you very much.
Okay, and it is a safe vaccine. It is a good vaccine. This is really if you think back to March of 2020, we were just hoping this was the answer, and this is really the way for us to completely get back to normal. So we want to all participate in that.
Thank you very much.
Thank you for having us.
Bye, Terry.
Take care. Bye-bye.